just wanted to warmly welcome everyone to our Enlivening a Culture of Health series. This webinar series has been ongoing for several months now. This is our third episode, and we'll be focusing on how the medical legal partnerships enable housing and health in Hawaii. This is a tremendous program. It's something that is deeply a part of the community health centers that we work with and a part of the communities that we serve. Now is such a great time for us to understand the social determinants of health needs of our members and outline a strategy for us to address those opportunities in the work that we do by learning from experts, such as those that will join us today from the Medical Legal Partnership of Hawaii and the University of Hawaii at Manoa's William S. Richardson School of Law. So this webinar is open to everyone as a learning opportunity for professional development and growth. It's also a safe place. It's an anti-racist virtual space led by the values of Hawaii. We really encourage questions and comments and discussion through the Q&A and the chat, but any form of racism and discrimination will encounter zero tolerance. We want to start 2021 off with a lot more community and a lot more positivity and a lot more energy going into this year than has been recently on the news. I'd like to start our webinar today grounded by some of our reflections learned in the Hawaiian community and helping us think of traditions that make somebody feel at home, someone feel safe and protected, and that a house and shelter is much more than someone having a place to sleep. So in Hawaiian tradition, we have this olelo no ea, we have this traditional proverb that says, okay, kahua mamua mahope ke kukulu. We build the foundation first, and then the structure itself, the building comes up. And that's a strong metaphor for us to use as we begin the new year. Look at that core foundation of our principles, our values, those beliefs, and then we do the building of our great work. Let's innovate new programs and services, and let's strengthen the ones that we have going really well. And that these hale that have gone through the process to kukulu, they don't happen in isolation in our traditions. They're actually part of a kauhale. So there's many hales in one that have specific functions. Some are for educating children. Some are where the food is prepared. Some are where women pound and beat kapa, so that those are the mats that we lay upon. Some are the places that house our canoe. This is a photo here of what these kauhale are traditionally represented as. And each of these hale that are put together make up that holistic and integrated wellness within our community, within that ahupua'a. So I just wanted to start with grounding us in these traditions and beliefs this early morning and this early part of the new year. These two are really esteemed guests who are highly regarded and respected in the legal health profession. AlohaCare is really proud to work with the Medical Legal Partnership as one of our new community sponsorships. We were able to provide a nominal support to their critical work during COVID-19. What immediately caught our attention for the Medical Legal Partnership and attorneys like Deja and Fernando and Dina is how they are working to protect client patients' rights in communities that AlohaCare serves and in the community health centers that founded our organization more than 25 years ago. You two are really at the forefront of helping protect client patients against harassment, threats, legal evictions from their landlords, but many other topics that we're going to jump into today. I'm going to do a brief and humble overview of your folks' bios, and then we're just going to jump in to the conversation and the learning opportunity for our staff and team here. Deja Ostrowski is a graduate of the William S. Richardson School of Law and comes to the Medical Legal Partnership with extensive experience in civil rights advocacy, health policy, and community organizing. Deja served as the public policy advocate for the Office of Hawaiian Affairs and previously held positions at the Domestic Violence Action Center, Hawaii Civil Rights Commission, and the Hawaii Appleseed Center for Law and Economic Justice. She's also a Tier 1 registered interpreter in Thai language. And in 2019, Deja was appointed by the Hawaii State Senate to serve on the commission, the Hawaii State Commission on the Status of Women, which is housed under the Department of Human Services that oversees the MedQuest division. Welcome, Deja. Aloha. It's great to see you and have you with us today. Fernando Cocio is a graduate of the William S. Richardson School of Law as well, and he began at the MedicalLegal Partnership during the fall of 2018, handling cases arising in Kōkua-Kalihi Valley Comprehensive Healthcare Center's population. Aside from instructing at the MedicalLegal Partnership and the clinical courses offered within the law school itself to budding attorneys and legal minds in Hawaii, Fernando is also supervising and mentoring law students and other UH graduate students as they will help serve as the new workforce to bring this medical legal partnership together and help it flourish across services such as family law matters, counseling, landlord-tenant issues, civil rights, anti-discrimination claims, no-fault insurance representation, and other important labor and worker compensation claims. Mahalo nui to you both as we transition into your PowerPoint presentations.
Thank you very much for the introduction, Kealoha, and thank you to everyone here today and for allowing myself and Deja the opportunity to share in a little bit of what we do. Let's see if I can go ahead and begin here. So as I mentioned, my name is Fernando Cocio. I'm a 2018 graduate of the William S. Richardson School of Law. And I began at around the fall of 2018 with MLP. Let's see here. See the poll response just popped up very quickly. I'll try my best to address that during the course of the presentation. So today I'd like to kind of touch a wide range of topics, starting at the bigger picture and of course kind of distilling down into the more precise, current and relevant points around the legal protections that are currently in existence in the state for folks in private and public housing units. So first and foremost, I'll be touching on what is MLP, how does our model work, what are the social determinants of health, and for some on the call today, this might be preaching to the choir. But definitely want to try to touch on a little bit of everything. And in addition, as I mentioned, what legal protections currently exist and are enacted under the law for those in both public housing and private rental units. So a little bit of background information on our program, the Medical Legal Partnership for Children in Hawaii. We're a nonprofit joint collaborative legal services program between the William S. Richardson School of Law and the Kōkua-Kalihi Valley Health Center. And we were founded in 2010, so we're going on our 11th year now. And over the course of the past 10 to 11 years, we've done temporary partnerships with other community health centers, such as Waimanalo Health and Waikiki Health. In 2019, we initiated some conversation with the folks in Maui about possibly starting up an MLP on their site. And it's definitely something that we have in mind moving forward into the new year. As Kealoha mentioned, our client population at this time exclusively services the KKV Health Center's patients, both medical, behavioral health, and any other patients that they have in their internal community network. As Kealoha also mentioned, some of the legal service areas that we traditionally service are housing law, both public and private, civil rights complaints. Oftentimes those arise out of claims for discrimination complaints arising in real property or housing settings, select family law issues, workers' compensation claims, insurance and public benefits disputes. And also recently, we are glad to announce that we brought on another staff attorney who specializes exclusively in immigration matters. And in addition to the direct legal services component, being that we are one of many clinical law school programs that are hosted within the William S. Richardson School of Law site, we also offer clinical courses to students, pro bono and internship opportunities for not only students in the law school, but also undergraduate students and other public policy related projects that are relevant to our area of interest, which over the past 10 plus years have been predominantly in the area of COFA issues and whatnot, although we're always ready, willing, and able to engage in a wide range of issues that might be relevant to our clients and the populations that we serve. So generally speaking, the MLP that we operate under is one of many. The motto itself actually started in Boston, somewhere on the East Coast, to my knowledge, a decade or two ago, and it has since been replicated and duplicated across the nation in many different sites. And I'd like to just take some time to go over more or less the general model of how a normal patient or client encounter would operate. First and foremost, that patient would have a medical or a behavioral health appointment. Secondly, the healthcare staff there on site would be trained to identify and flesh out legal issues during their intake or assessment and appointment process. Oftentimes we refer to the mnemonic here, I help, to kind of give some insight to practitioners and they can use to incorporate in their questions. Some of those main topics include income, housing, education, legal status, literacy, and personal safety in order to elicit information and concerns that the client might have that would then trigger a legal need. From there, the healthcare staff would receive patient approval to contact an attorney such as ourselves to initiate a formal referral process. And this is what begins the actual investigation stage. From there, the attorney, such as myself or Deja, under normal circumstances would meet in person with the client, oftentimes more or less piggybacking right off of their medical or behavioral health appointment, right there in the treatment room. So it's very fresh, there's a warm handoff opportunity. Due to the pandemic, however, we've been working remotely, but nonetheless, we still utilize things like Zoom and conference calls and work with interpreters to mimic this same process. From there, the attorney and the medical legal partnership will decide to accept formal representation of a client or to decline based on maybe limitations in a certain practice area. So based perhaps on the complexity of the claim, if we find perhaps it might be a medical malpractice issue, we have certain attorneys that we might refer or collaborate with. One area that we by nature are precluded from handling are direct criminal law or criminal defense issues, being as that's something that's traditionally handled by the prosecutor's office and the PDs. However, there's a small caveat to that, being as we've recently enlisted a full-time immigration attorney, we are able to address criminal law issues that perhaps might have an immigration consequence. So for example, if a client comes in, say they're Micronesian or CHCs, they've been charged with a DUI, and the concern would be maybe not necessarily on the direct criminal defense aspect, but more or less what sort of immigration repercussions might come to the surface as a result from being charged with this crime, or if the individual is convicted or if they do plead out. That's something that our immigration attorney, Catherine Chen, can meet with the client on. And lastly, moving forward after the attorney-client relationship has been established and we accept the client as a formal client of ours and we're their formal legal representative, we'll continue to advocate for legal issues and consult with healthcare providers as needed during the course of our representation. Of course, always with patient approval and in accordance with our own ethical guidelines, as well as the HIPAA guidelines that bind the health centers that we work with. And my advanced apologies, I'm sorry, I'm unable to see any prompts that come in with regard to Q&As and chats, but I'll do my best to address those in sequential order. I only have about 10 or 12 slides, so I'll allot some time for that. Switching gears a bit to the social determinants of health, and again, maybe for many on this call, I'm sure you folks are generally the experts in this area, so I might be preaching to the choir here, forgive me. But for those that are unfamiliar with this concept, as I know I was definitely in law school, I want to spend a little bit of time just kind of addressing these bigger issues, these factors, and these theories, and how they intersect and weave into areas of the law, specifically housing and the need for stable, sufficient housing. So as per the World Health Organization, they define the social determinants of health as circumstances in which people are born, grow up, live, work, and age, and the systems put in place to deal with illnesses. These circumstances are in turn shaped by a wider set of, I like to think of them as more or less intangible forces, such as economic, social policies, and politics. And oftentimes when giving these sorts of presentations to more introductory groups, I kind of liken it more akin to societal and circumstantial elements rather than innately biological or innate genetic predisposition. So people aren't always bound more or less by what they're made of more or less on a biological or genetic level, but these other surrounding elements and circumstances that they live from one day to the next, and the effects, oftentimes negative, unfortunately, that it may have on their health and subsequently any legal issues that they might encounter. So this is a diagram that does a much better job of explaining, the interplay between the main 6 social determinants of health, further subcategories, and the consequential health outcomes, oftentimes, unfortunately, negative in certain scenarios that we see. And just using, two as an example, something like economic stability, which of course during the last 6 to 9 months have really rocked this island, not only the patients and clients that we service, and I'm sure, the members that you folks see in your day-to-day business, but everyone more or less. I mean, this island is really founded on, big industries, tourism. I know, off the record, just with a lot of friends that I've had, longtime workers in the hotel community, literally from one day to the next, without work for an indefinite amount of time. So this area is something that's very relevant, and it leads to immense negative effect, especially in the domain of housing, rent, mortgages, and the like. So just using economic stability as an example, you can see the subcategories that it affects: employment, income, expenses, debt, medical bills, and support. And another area, although they're all relevant and important, but one that I wanted to touch on for purposes of this presentation is the area of the healthcare system, and really the importance of having a community health center versus, say, perhaps a traditional model. And within those subcategories, this factor encompasses health coverage, provider availability, provider linguistics, cultural competencies, and quality of care. And of course, the interplay and the texture juxtaposition of these factors against future health outcomes, be them negative or positive. And one thing that I wanted to touch upon on the conversation of, healthcare systems is that one thing that we've seen, biases aside, of course, being that we work exclusively with KKV, is that because these institutions are so closely connected to the patients that they service, and because the community sees them as a place of refuge, a safe place, as Kealoha mentioned, a place where providers can really advocate for them, we found that those institutions were a lot better at dealing with some of the the influx of patients and concerns that really came into fruition after the pandemic started. So by that I mean, we were finding that at KKV, they had all the resources internally to do everything that the state was attempting to do early on, be it with a lot of interference and turbulence and really rolling out. They were doing the home visits, they were doing their own internal contact tracing, they were doing rent relief, they were doing meal support, food support, further social services. And I do believe a lot of that is because of the close proximity, not only of the health center just literally being a walk down the road, but also having those core foundations and those lines of communication already open, so that when a disaster such as a pandemic strikes, they already have everything they need to mobilize their services. Taking the conversation a step further into the relationship between social determinants of health, which is more theoretical or maybe traditionally health-based, into the realm of legal services. And this is just a small but nonetheless widely encompassing list of the various social determinants of health that can be addressed with legal services. So from what you can see here, there's a wide range of legal claims that can exist and arise under these various domains. And speaking to something that I handle quite a bit of, in my work with the Medical Legal Partnership, is this issue of housing insecurity, the focus of today's presentation. And this list here, these examples really don't do it justice. And sadly, over the past 6 to 9 months, we've seen a lot more activity, a lot more creative ways that landlords, either consciously or unconsciously, are creating difficulties for their tenants and residents. And just to list a few here, evictions or foreclosures, utility shutoffs or illegal interferences and terminations, landlord neglect, which causes the property to go into a state of disrepair, creating an unsafe living environment. And that kind of dovetails into the last one: molds, pests, and other unsafe living conditions. Something that we've seen a lot of over the course of the last few months is, or are requests from providers to incorporate more of these reasonable accommodations into their clients or their patients' living arrangements. And perhaps maybe now that more families are spending more time at home, these needs are becoming even more apparent than they were beforehand. So we're working on several cases as we speak, some before the Civil Rights Commission, some just in the negotiation phase, but nonetheless, something that we have noticed an uptick on in our end. So transitioning a little bit from the conversation of social determinants of health to the specific relationship into various legal effects and legal claims, and then kind of dialing in a bit further into the economics of Hawaii as it pertains to wages, housing security, housing insecurity, and so on and so forth. And this is something that I like to present prior to the information about the housing, because I think it really puts everything in a perspective. And as we all know, Hawaii is a very expensive place to live. Last time I checked, I think one of the top 3 right up there, in square footage costs with the Bay Area, which is where my family's from, and then also places like, Manhattan and New York and whatnot. And as of 2020, right now, although there's been some push to increase this amount, the minimum wage is still approximately $10.10 per hour. At a federal level, it's even lower, about $7.25, which equates to $15,000 annually. And this institution here compiled their figures on what they claim to be a livable wage versus what we know as the standard minimum wage. And the Hawaii Department of Business and Economic Development and Tourism set their standard at $17.63, meaning that in order to comfortably live and pay for your necessary expenses, they didn't clarify, at least from what I was able to gather, the number of individuals in a household. But in order to comfortably live, pay for expenses and necessities, you would need, an average income of approximately $17.63 per hour. And being that the minimum wage is set at $10.10, you don't have to be a mathematician to see that there's obvious discrepancies there. And as a result, it will lead to, further complications and problems that oftentimes have a legal undertone. So these are just some figures that, we like to share with folks. And a lot of this might already be self-explanatory, but, things like school supplies, if you have children, $50 to $75, and the amount of time it would take you to, work in order to pay for those expenses. A medical copay, which depending on the health institution, they may or may not waive that, or the policies of the certain insurance provider. Getting more specifically into legal costs. Now, we don't charge a cost for our services. That's part of, our agreement with the KKV Health Center. All services are provided at no cost to the client. But under normal circumstances and things like filing fees, those are things that, short of getting a waiver for them, those fees go to the court. So that's not necessarily something that we would cover, or other public interest law groups. A divorce filing fee these days is upwards of $215 to $260. I believe the guardianship fees are around there as well. That's about a day's worth of work. And by a day, I mean, 3 working days at 8 hours a day. And once you start getting into the conversation of immigration fees, it really skyrockets. And under this last administration, hopefully it'll change, but a lot of those fees were non-negotiable, non-waivable. So something like an I-94 would set you back $450. And, you can see the amount of time that it would take an average person to allocate those funds, of course, aside from all the other pre-existing bills that they might have for housing, childcare, food, and the other basic necessities. This is another very interesting figure here. And again, some folks might already be aware of this. I know for me and my wife, when we were looking for our first place, this became very apparent to us very early on, just the sheer cost of housing, both private and rental housing in the state of Hawaii. And this figure, I think, surprisingly, has actually gone up since the beginning of the pandemic. I spoke with our realtor a week or two ago, and she said that contrary to many people's beliefs, during the course of the pandemic, the median home value cost has actually gone up. I believe now it's well over $700,000. And with that, the monthly rental amounts have also gone through the roof as well. And what they found here, based on the Neighborhood Scout quarterly report in 2018 through the U.S. Census Bureau, is that as of that time, median home values in Honolulu County were just a little under $700,000, with the average market monthly rent being a little over $2,000+ and home ownership rates being somewhere, right around 42.5%. And the flip side to that coin would be, and this kind of dovetails and kind of further expands on the prior conversation of livable wages, is that in order to comfortably afford a 2-bedroom private housing rental unit, either an individual or coupled with their partner or spouse would need to collectively allocate $31.61 here in the state in order to comfortably meet that demand for housing. And I don't believe that that's going down anytime soon. There are some conversations on the back burner about what might happen after these eviction moratoriums and foreclosure, protections expire. Will that bring inventory up? Will that bring inventory down? I think the conversation, to the former would be more, in my opinion, we would expect to see that maybe more so in the commercial real estate setting, as many commercial clients opt to go remote, use things like Zoom. They might not need more office space, but short of a mass exodus from the island, of local citizens, I don't foresee a situation in the near future where demand for private housing or, private home purchases would dry up anytime in the near future. So that is the conversation on the private side of the coin. On the other side, I wanted to touch briefly on, the Hawaii public housing landscape here in the state of Hawaii, and specifically in the city and county of Honolulu. And just to kind of give a little bit of background information, being that the Kukuakalihi Valley Health Center is right there in North School Street, they're conveniently situated close to some of the larger public housing properties in the state. So KPT, they've since rebranded their name, but the towers are literally right down the block. The low-rise units are right behind the wellness center. Cam 4 housing is, just a ways up the block there on Kamehameha 4 Road. And other clients who reside in the nearby areas, such as Mayor Wrights or Kukui Gardens, some of them also come to the community health center as well. And interestingly, over the past, decade or so, we've seen the state selling off part of their public housing portfolio to private developers or private owners. So now, for instance, the KPT towers are privately owned and operated by a mainland corporation, although they're primarily still offered as public housing or Section 8 units, with the exception of the top 2 floors, which are presented as market rate units. The same, to my knowledge, is said of Kukui Gardens. If you look at the eastern part of the property closest to River Street, a large portion of that was sold off at once to another mainland developer, and they now run those properties and they present those to the public as market rate. However, speaking with clients, a lot of that market rate information, at least based on those that we've encountered, are similar to the other charts that I provided. They're upwards of $2,000+ per month for a 2 or 3 bedroom, not counting utilities oftentimes. So to what extent it really is market rate, I mean, that, the jury is undecided on that one, so to speak, but it's definitely not something that most people can get their foot in the door right away. But speaking specifically on Hawaii public housing, there's 2 large programs that we service by way of clients who might have potential claims or questions, and those are folks residing in Hawaii Public Housing Authority properties, and a few folks that are the recipients of the city and county's Section 8 program. And for purposes of this slide, I'll speak specifically to the first example, the Hawaii Public Housing Authority. And all of this information is taken directly from their most current annual report, and I've provided the link here. So Hawaii Public Housing Authority, they operate both, public housing and Section 8 programs. They also offer a housing choice program. Some of you folks might already be familiar with that, where the recipient is obligated to go look for a landlord who will then accept receipt of the voucher. And oftentimes that could be just in a private housing situation. It could be a standalone unit. It wouldn't be these larger structures or these larger properties that are encompassed within this report, such as Mayor Wright's, KPT, CAM4, and the like. And generally speaking, they manage and oversee approximately 6,200 individual units, servicing over 5,600 individual families comprised of 19,000 plus members. And most of their programs are income-based. And generally, what we like to tell folks is whatever your household income is for that month, your rent will be calculated at 1/3 of that total, allowable household income. So that could come by way of income from work, maybe perhaps Social Security, disability, other, support payments that would be encompassed in the calculation. And from there, management would then draft the bill 1/3 of that total household income. And, one thing that we found especially during the course of the pandemic, and it's understandable because of everything that took place in such a short amount of time, is that a lot of people, at least, the clients that we service, they weren't getting formal letters of termination or, furlough notices. A lot of these things were happening from one day to the next, 1 week to the next, during that midpoint in March. So basically, the way it works is, as I mentioned, rent is calculated at 1/3 of total household income, but the burden is on the tenant to inform management of any changes. So if they want a rent reduction, it's on the tenant to present, work information, pay stubs, notices of termination or furlough to the management staff so that they can then properly adjust the rent so that it's effective the first of the month. But a lot of these places, due to public health measures, they weren't open. So a lot of folks had a real difficult time in trying to provide the necessary information, inform, their landlords and the management of the circumstances so that their rent can be brought down to a manageable level. So a lot of what we've been trying to do over the course of the past few months, amongst a host of other things, is really trying to get ahead of that and trying to resolve those issues so that they don't lead to an eviction or some sort of displacement attempt down the line. And that brings me specifically to the current eviction moratorium that is present here in the state of Hawaii. I'm sure many folks are aware of this. It's something that, unlike the federal moratorium that was enacted, last year, this has been more or less on a month-to-month or a 2-month basis. And as of right now, it's extended until about the midpoint of February of this year. And specifically, because there's a lot of miscommunication or a lot of questions about this moratorium. It's not a forgiveness program, so tenants are still encouraged to negotiate with their landlords. I believe the mediation centers of the Pacific, they were offering their services for folks in order to, bring in your concern to a third-party mediator to negotiate a payment plan. But it's not a forgiveness policy. So the reality is that people will still be accountable for properly counted non-payment of rent after this moratorium lapses. And with that being said, this moratorium only covers non-payment issues. So a landlord can still terminate a lease or move for a future eviction if there's other standalone independent lease violations that are previously set forth in the lease agreement that they signed, such as criminal behavior, improper use of the property, either intentional or neglectful damage to the property, etc. Truth be told, we really haven't seen a whole lot of this. Oftentimes, and again, just in an effort of full disclosure, we primarily represent tenants, not landlords. So granted, we're seeing one side of the story, but we haven't been seeing anyone who has been engaging in criminal behavior or purposely damaging their property. On the contrary, they're trying to remain low, remain situated, especially during the course of this pandemic. Sometimes landlords will take what they perceive to be maybe damage to the property, and in our opinion, maybe use that to circumvent these moratoriums. And for those cases, we're responding accordingly. But by and large, most parties seem to just be waiting it out and to be looking for a way to renegotiate, apply for rent relief, just to kind of clean the slate so that they can move forward once this moratorium ends with a clear balance. With that being said, under no circumstances can a landlord threaten, coerce, or intimidate a tenant in an effort to obtain payment. So they cannot lock a tenant out. They cannot interfere or terminate their utilities or withhold basic utilities in an effort to obtain payment. They cannot harass or intimidate. They cannot threaten to terminate their lease at a future time. And all of this information is coming directly from, the governor's emergency provisions. And there's been other legal groups that, in addition to ourselves, that have kind of spoken out on this issue in an effort to try to kind of align everyone on the same page. And some options that are currently available for folks are certain circuit and district court filings. As I mentioned, a lot of those are still subject to this eviction moratorium. My last reading of the judiciary's notice as it pertained to district court, which is normally the court there on AlohaCare that adjudicates these claims for eviction, is that they are still taking full notice of the governor's emergency proclamation. But if there's other standalone terminations or issues of that nature, those would be things that perhaps they would entertain and schedule for a proper court date. In addition to that, we've also referred folks, especially where some of the landlord activity is especially egregious, to the Department of Consumer Affairs. They have a landlord-tenant line. Folks can call in. They can, leave their concern for both sides, landlord or tenant. And if it's something that warrants further investigation, they have their own attorneys and staff members that will investigate any claims of unfair, deceptive acts and practices on the part of a landlord, anything that's done to coerce or threaten and intimidate a tenant. Tenants also have an option of pursuing things like TROs for illegal lockouts, utilities terminations, and of course, any standalone claims for harassment. And something that we've actually been using recently is putting forward some of these claims to the Civil Rights Commission if there is a valid underlying claim for discrimination. So if there is, say, some sort of landlord-tenant behavior that does not touch into the realm of, discrimination or something that's protected under state or federal fair housing laws, then that would be outside of their scope. But if it touches on any sort of age or, disability-related discrimination, amongst other things, then that is something that they would be interested in seeing, and they're subject to their own timelines and procedures as well. And lastly, I just wanted to share with you folks, feel free to visit our website. This is something that we've poured a lot of time into during the course of the pandemic to improve the presentation and the aesthetics of the website, and also the accessibility for anyone and everyone in the community. And specifically, we've worked on this page here called MLP Alerts, which contains a lot of this information, current updates of the eviction moratorium, immigration information, and other pandemic, related matters that folks might find helpful during this time.
I think we're okay on the chat and the Q&A, Fernando. Thank you so much. You provided such a great overview and so much important facts that have helped to decide where we go with some of the resourcing in these different programs in Hawaii during the pandemic.
Sure, thank you so much.
Aloha, everyone. Thank you for joining us today. And I'm going to just continue on with more of what MLP does with Fernando. Here is just some pictures. These are historical pictures of us with the team at KKV and some of our people who work with us. So very quickly, what we do, Fernando kind of touched on all of them, but I'm going to focus on one part of what we do. Fernando talked a lot about our direct legal services, which is providing direct legal representation to people in the clinic who are referred by their community health center staff, whether it's now at KKV or when we have done it in the past at Waikiki Health and Waimanalo Health Center. We also do trainings and outreach. So this is something that we do not just in the community health center context, but all over. So we've done some with community outreach court with the PDs and various other community organizations. Our Know Your Rights and self-advocacy. Fernando does a lot of Know Your Rights training with different groups that we have. I've done a lot of other ones too with different community organizations. And that's how we get to know lots of different people, because we do a Know Your Rights training and then people bring up a lot of different issues. The other thing we do a lot of, which is kind of what do we do with all of this, all of the information that Fernando shared, which is systemic advocacy and policy work. And that's where we try to take the social determinants of health and preventative lawyering, as we call it, to even further, which is what can we do to address these systems? A lot of times in the health context, as well as in the legal context, we focus a lot on a diagnosis model. And I think we see this a lot. We talk about it as being very individual focused, and that's kind of what people talk about with genes, your individual genes. And the social determinants of health is talking about how do we move to seeing individuals and also seeing the systems. So one of the most important, I think, attitude adjustments that is hard to make, and we try to make all the time, is that it's not individuals that are to blame or people who need to change, but how can we make our systems change and make our systems easier to reach for people, rather than placing the blame on people themselves as hard to reach. So what we do at MLP, I see it as like an ahupua'a type of model, which is what the social determinants of health are about, looking upstream and remembering that all of this feeds each other, which is doing direct legal services the community training, and also the policy analysis and advocacy. And how can all of us in our individual roles, whether we're with the health center or a lawyer or wherever we are, try to think more how we can continually move to, while we are doing the downstream work, move upstream and look at the upstream ecosystem and the entirety of where people are living and working and playing. And remember that we are people who are impacted by systems. So even though we do have inequality in individual earnings and mediums, it's also inequality that comes from, for example, we can see with Native Hawaiians, it's Native Hawaiian women who make so much less. So we're talking about people impacted by systems that affect Native Hawaiians, that affect Pacific Islanders unequally, as well as affect women and families unequally. So what we try to do is, when we're working in our advocacy, that it's kind of easier to stay at the bottom, right? Defining a problem at an individual level, an individual person, and then also changing the basic conditions to moving forward and thinking, what can we do that will take this to a community level and change how our community is? And that's what's hard. I think a lot of you may see when you're working with people, for a lot of people, this is a very new and special and individual thing to them. But as you know, when you start having, I don't know for you guys, but when you start having the same problems pop up over and over and over again, the same, cycle or churning of people kicked off benefits and then back on, kicked off benefits and back on. How can we start to move forward and say, how can we change the system? How can we really take ownership of what we have as a system going on, that everybody keeps getting caught in the same way? And so I know for me as a lawyer, that can be what is one of the most difficult things, is having people repeatedly have the same problems, and you can change it on an individual level and you can get someone back on benefits, but how do we make sure that doesn't keep happening over and over again? And start to really move for, as you know, in health profession, for us in the legal profession, we're not as used to framing things as prevention and community rather than just an individual problem. So this is kind of a slide that we created to talk about all of the different revolving doors that when you're working in this system as a legal professional, as a case manager, as a shelter system worker, as a person at the hospital, these revolving doors that people start to churn out of. And so this is what this is, a white paper, I will call it, for us to talk about that these revolving doors are all of our attempts to deal with community challenges. For example, if someone is disabled and they can't work, they're either on Social Security and they're living on $788 a month, or if they're waiting for their disability for Social Security, they're making $388 a month in welfare. And that's something we can't change. Those people are unable to work, they're unable to increase their income. And I think that that's something where, how can we talk about escaping that revolving door rather than someone revolving through the shelter system? As we know from Fernando's presentation, if you're making $788 a month, you're really not going to have a lot of time to find any kind of place to rent, right? And so these are kind of some of the challenges that we see in these revolving systems. And for us as lawyers in particular, we see a lot of people saying, well, people aren't getting help in the shelter system. They're not getting help in the hospital. Maybe we can pass that on to the criminal justice system. And that's why we have this together, to talk about how the criminal justice system as well is also just something that is temporary. It's something that has consequences that someone can deal with. And so what do we need for people? We need them to be able to have an easily accessible lawyer for legal services, permanent supportive housing, community care and compassion, and also us focusing on systemic changes that we need to make. And so this is ways for us as lawyers that can talk about how we interact with all of these professionals, and all of us are on board to deal with these community challenges. I'm gonna just briefly go through this slide because Fernando talked a lot more about it. When we are dealing with the eviction prevention, while we are dealing with the cases individually, we thought about how can we take this even further and talk about this as a community and taking ownership of these evictions that are happening illegally. And so what we did is create a report, Just Neighborhoods, as well as the the policy piece in Civil Beat that we published along with the Marshallese Community Organization of Hawaii, to really talk about how it felt for the community to be subject to so many criminal citations for things such as got out of their car and weren't wearing a mask, or were living in public housing and just happened to pop out of their door and got a mask and a mask violation and a ticket. While at the same time, there are landlords who are illegally evicting, harassing, and not finding any kind of help by the police. And so this idea of how we respond to these public health crises with the legal system was to really punitively come down on people living in public housing, come down on people for not wearing masks and violations, while landlords are still illegally evicting and really not facing that same type of messaging. And so one of the things we talk a lot about is some of it is about the messaging and the way that we talk about what the regulations are. There wasn't a lot of messaging about maybe the shared sacrifices that landlords could make. And in particular, what we had a lot of trouble with is it's now been reported in the media, a lot of families who had applied for the rental assistance, they had applied for every single type of government assistance available, and their landlords refused to accept that because their landlords, for whatever reason, were renting under the table and didn't want to pay the taxes. And we had a very significant number of people who tried everything in their power to get money to their landlord, and the landlord would rather illegally evict and not get that rent rather than pay the taxes or even be, looking at accepting the government assistance. And so this is where we talk a lot about even messaging can be part of a systemic advocacy piece and prevention for illegal evictions. So one of the other issues then that has come up is that this exact situation where a lot of people had to rely on government support and welfare for maybe the first time in their lives, particularly for a lot of renters. Maybe they had been renting, they were working a job that suddenly, because of the pandemic, they were not working anymore. And so for a lot of people, it was maybe their first time dealing with welfare assistance, dealing with cash assistance or renter assistance. And it brought up, I think, new energy to a problem that has existed for a long time. I apologize for the noise. And that is that for a lot of renters, and I know this even for myself, they didn't want to even give to their landlord the appearance of financial instability. And so they would try everything in their power to not let their landlord know they were having trouble paying rent or that they were receiving any kind of government assistance. Because we, unlike a lot of other states, so 10 states, 14 counties, and 56 major cities actually have legislation that prevent what we call source of income discrimination. And that is the idea that a landlord can evaluate a tenant for their financial ability to pay, but they cannot sort of give them what we call, that undercurrent type of idea that because your rent is being paid by a government program, that you are financially unstable or that you do not have the funds to pay this, even if on paper they're receiving that money and it's coming in. So one of the biggest examples of this is Section 8. As many of you know, Section 8 pays fair market rent. So right now for a 1-bedroom, that would be equivalent for what Section 8 pays. It depends on what area of the island, but say here in Honolulu, it would pay around $1,700 to $1,800 a month for a studio. What happens is the individual person pays 30% of their income, which will change as their income fluctuates. And then the Section 8 program, the government will make up the rest. So the landlords are actually receiving market rate for their rental. But for a lot of the landlords, they don't want to be involved in that program because it does come with it some things such as there's an inspection every year. And so the inspection needs to make sure that your unit meets basic habitability standards. And that's something that a lot of landlords, I guess, are not willing to take on that burden. So this is something that we've talked a lot about changing through a bill. And so this year we are working with the Commission on the Status of Women is doing it, OHA, and we're talking about how this is actually used as a pretext, which we have seen, to hide illegal housing discrimination. So a lot of people may be receiving vouchers for the permanent supportive housing, and the landlord will say, I don't want to accept that person because they have a voucher. But when you start drilling down on why, it starts to turn out, well, it's a huge family and there's just so many kids, and I just don't think that we want them to be living in that unit. And so this is a bill that we're going to be working on in the next session to bring Honolulu up to standards so that we are strengthening our landlord-tenant law and protections. I'm going to, because of time, switch real quickly, just click out of another one. So what the really important thing for us to think about is that it's policies that we have that are impacting the social determinants of health. And so a lot of times, like I said, we have legal policies that are impacting people's social determinants of health. And one of the issues we see a lot of is poverty issues pushed onto the legal system. So for example, the sit-lie ban, where we have clients that we've worked with that have hundreds of court dates and tickets, a court date every single morning for a sit-lie ban, for smoking. And really what their issue that they have is civil legal needs. So they need identification, they need help with an employment discrimination case or an immigration case. So for example, here is a client who allowed us to share some of their information. They have more than 99 tickets, 2 of them on the same day, and they had a bench warrant in which they went into jail for a smoking ticket. So it was, you know, someone in jail for smoking and lost all of their stuff, very hard to get in touch with them because they couldn't make bail. And so that's something that we see a lot of for us to start thinking about, how can we make some changes here? So I think the takeaway message I have for this is that all of us are professions that are working together. And I think for a lot of us, we start to think maybe the legal system is better for this. Maybe the medical system is better for this. Maybe the mental health system is better for this. And I think what's really important is that all of us need to work together and think about 3 things, which is how can we be better systems thinkers? How can we really start to talk about power and collaboration, that we can work together to change these systems, since we are the ones in control of them, right? I talk a lot about how businesses don't say, oh man, customers never come and use my services. We actually say, how can we change our services so that it's easy accessible to customers? And then how can we work better on dealing with those implicit bias that we all have? And I know it is easy to get there when you have so many people you're working on and they have the same kind of thing. And how can we make sure we work toward those? And so for the last slide, and this is even a challenge to myself that I have to put up and think about all the time. Does my approach ask the right questions? So am I really asking the right questions about what we can do? Am I deflecting attention away from the upstream sources? Am I blaming the victim? Am I reinforcing unequal power relationships? What can I do to really change some things and think of what is in my power to change? What are some systems that I can do that can change and work for these? And so I leave with a quote from Jojo Peter, who was a very well-known Micronesian advocate and the first Micronesian member of the Hawaii Civil Rights Commission, which is, what you leave behind is not what is engraved in stone monuments, but what is woven into the lives of others. And I think that's a challenge for all of us to think about, how can we work with people impacted by systems and take ownership of what we can change for continuous system improvement. So thank you, everyone.
Such really important information. And I wrote down those 3 recommendations, and I'll be providing that back to everyone when we provide the resources, and make sure that we get all of these links to everyone. So what I wanted to do was just close out by reminding everyone to thank them for coming, and to remind them about the Survey Monkey. I just really want to thank everyone for attending. I especially want to thank the Medical Legal Partnership of Hawaii and Deja Ostrowski and Fernando Cocio for being with us. Just strong health legal minds and advocates, practicing attorneys working directly in the communities that we serve. We're so grateful to be able to start this new partnership and work with you folks. Continue to update us and inform us. And we really, we want to take you up on those suggestions, Deja, and these recommendations that you have for us ahead. There's just one last question here, And there's a hope that maybe some of these services and programs will be available on neighbor islands. And I hope that that's something that we can follow up with you on in the future and figure out how that might be possible, since AlohaCare does serve all islands. And we want to make sure that this type of tremendous information and legal health servicing is provided to as many people as possible in the months and years ahead. We are coming to a close of our webinar here, and I just, I again want to mahalo our leadership for taking on this new platform to bring in the social determinants of health as a clear focus. My name is Aloha Fox, and I am really tremendously honored to be a part of our bridge to connect better social health integration into the clinical and medical field and public health services that we offer. Thank you all. Please continue to stay safe. Happy New Year. And we look forward to continue working with all of you in 2021. Aloha.